February is Heart Disease and Stroke Prevention Awareness Month. This is Chinese General Hospital and Medical Center Cardiologist Dr. Timothy D. Heart disease continues to be one of the top causes of mortality and morbidity in the country. Heart disease refers to anything that can go wrong with the heart, and the heart is made up of many structures. It's almost like a house. There are doors, there are water pipes, and there are electrical wires, and the heart is much the same. The heart can have problems from birth, which is called congenital heart disease, and there are acquired diseases that we get as we grow older. We have coronary artery disease, which is blockages of the heart arteries. We have valvular disease, where the valves in the heart can become narrowed or leaky. We have even electrical problems, where patients' electrical condition or conduction of the heart deteriorates, where they need devices like pacemakers and such. So heart disease is a very general term, and each patient that has heart disease will need to be checked to find out what kind of heart disease they have. One of the most common types of heart disease is coronary artery disease, or blockages in the heart arteries. There are many things that can cause coronary artery disease, and these are what we call risk factors. Risk factors range from hypertension or high blood pressure, high blood sugar or diabetes. You can have high cholesterol, high bad cholesterol, high triglycerides, smoking, whether first-hand or second-hand smoke. Other risk factors are risk factors that we cannot do anything about, such as family history or gender. But all of these risk factors contribute to the development of coronary artery disease. One of the most common questions we get is, how do we reduce the risk of heart disease? Well, obviously, if the risk factors are the ones that we mentioned above, all of these risk factors will need to be controlled. So blood pressure needs to be controlled, not just short-term, but long-term. Sugar, cholesterol, triglycerides, these all have to be controlled. And people who smoke or are exposed to secondhand smoke would really need to try to focus efforts on quitting smoking. There are risk factors that we cannot do anything about. For example, gender. Men will always be more likely to have heart disease or coronary artery disease than women. And then family history also cannot be modified. So we have risk factors that are non-modifiable, and we have risk factors that can be modified. And the way that we reduce our risk is to focus on the modifiable risk factors. There are people who are at high risk, and there are people who are at low risk. Who are the people at high risk? The ones that are most at risk are those people who have a combination of risk factors. For example, people who have high blood pressure might be 2 to 3 times more likely to develop coronary artery disease. People who have diabetes are 3 times to 5 times more likely to develop coronary disease. But if one patient has both, then the likelihood of coronary disease is multiplicative. So if somebody is 3 times with hypertension and 5 times with diabetes, when somebody has both, that person is 15 times more likely to have coronary artery disease. So the more risk factors you have, the higher it is that your risk is. We have a lot of treatment options here at Chinese General Hospital and Medical Center Heart Institute. We range from treating risk factors, and these have to be done at our outpatient clinics. We are staffed by qualified cardiologists, so we have 40 active consultants here and a higher number of visiting consultants who can treat patients on an outpatient basis and reduce the risk of coronary artery disease by controlling hypertension, diabetes, cholesterol, triglycerides, and also smoking cessation. Treatment options also depend on what type of heart disease a patient has. So diagnosis will need to be made before we can actively treat patients. We have a very fully equipped heart station that offers all kinds of diagnostics, from ECGs to treadmills, to echoes, to stress echoes. We can also diagnose disease outside of the heart, vascular disease in the arteries that feed the brain, such as the carotids, arteries that feed the kidneys and the legs, all of these are available at our heart station so that we can provide a comprehensive diagnosis for our patients. In general, when patients are diagnosed to have heart disease with non-invasive means in our heart station, the diagnosis needs to be confirmed. And confirmation is usually done here in the cardiac cath lab. The cath lab is equipped to diagnose coronary disease, valvular diseases, congenital diseases, and once these are diagnosed, treatment can also start here. The cath lab is fully equipped to perform coronary angioplasty and stenting. We can also perform structural heart interventions such as transcatheter aortic valve replacement or TAVR. We can also perform repair of mitral regurgitation with MitraClip. We can also close congenital heart defects like atrial septal defects, patent ductus arteriosus or PDAs, and including ventricular septal defects. We can also treat dissections and aneurysms of the aorta with thoracic endovascular aortic repair or endovascular aneurysm repair of the abdominal aorta. We can also address narrowings of arteries in the neck, arteries in the kidneys, and arteries in the legs by performing angioplasty and stenting in these areas. The cardiac catheterization unit can also perform intervention in non-cardiac areas such as biliary drainage, and we also provide support for our neurosurgeons when they do kyphoplasty. But treatment does not end here. There are patients who need surgical treatment, patients who need bypass surgery, patients who need valve replacement, patients who need aortic repair surgically, and these are done in our cardiovascular operating room. The cardiovascular operating room is staffed by very qualified surgeons, and once the patient is operated on, the patient is then taken care of in our cardiovascular recovery room and our cardiovascular telemetry unit. And after these patients recover from surgery, these patients are fully rehabbed in our cardiac rehabilitation section. It provides several phases of cardiac rehab from immediately post-op all the way to when the patient returns to normal life. So the treatment options here at Chinese General Hospital Heart Institute is very comprehensive, from diagnosis to treatment to recovery. So my message to all of you is this: if you feel that you might have heart disease, please do have yourself checked. One of the things about heart disease is it can be called a traitor, because people who don't feel anything can also have heart disease. So if you want to be safe, even if you are asymptomatic and don't feel anything, it is still better to have your heart checked. 30 to 40% of people who are about to have a heart attack don't have any warning, and they are taken by surprise when they eventually have a heart attack and find themselves in a life-threatening situation. So before that happens to you, please have yourself checked. We here at Chinese General Hospital and Medical Center are ready to serve you. To receive exceptional heart care, please call 8711-4141 local 291, and we would be at your service and happy to help you. Thank you very much.